We are excited at this time to welcome Dr. Lisa Indar as the new Executive Director of the Caribbean Public Health Agency, which many of you know as CARPHA. With a wealth of experience in public health leadership and previously serving as the interim Executive Director, Dr. Indar steps into this pivotal role at a crucial time for the Caribbean region. So firstly, I want to say congratulations on your appointment, Dr. Indar, and welcome to TTT.
Thank you very, very much, and thank you for inviting me.
Not a problem. Well, we want to get right into it. We know that it is your vision for CARPHA, as you have illustrated before, having an alignment and having interventions to the uniqueness of the Caribbean region. So we really want to find out, with respect to your strategic vision for CARPHA, in particular the member states, can you elaborate a little bit for us on how CARPHA plans to really tailor its public health approach for the diverse needs of the 26 member states?
Yes, thank you for the question. So, as you're aware, CARPHA is the regional public health agency, and we serve 26 member states. But these member states are diverse and they have common issues, and they're all small island developing states, and they're diverse in the fact they have varying levels of capacities, surveillance and laboratory capacities, but they're highly interconnected. They have porous borders, heavy reliance on tourism and vulnerable to climate change, disasters, aging population. So these commonalities and their diversities in terms of political and their cultures and all of that, it really requires a regional type of approach. It requires, robust systems, political will, buy-in, and coordination so that, disease illness in one country more or less means a disease illness in the region because of our interconnectivity. So CARPHA, as a regional public health agency, and my vision is to create Caribbean tailored specific interventions as meeting the specific needs of the region, tailored for small island developing states, countries that may or may not have regional referral lab who cannot do a PCR testing, or may not have the capacity to do certain things, may not have the capacity for early warning and response. Our goal is to provide that regional solution that can be applied across the board, and where we hold countries' hands to see. To get things done.
As you're talking about that regional collaboration, I remember during the COVID-19 pandemic, you would have had significant work during that time and had a significant regional response as well, where under your leadership, the future of the public health response was changed in the Caribbean. What do you think, in your opinion, are some of the biggest health challenges facing the Caribbean right now or even going into the next 5 years?
So, our health challenges, and if we were to categorize it, first is NCDs. We don't talk about it because people see the communicable disease, but we know non-communicable disease a big issue. It's still the number one cause of mortality, and it's still the big issue. But then we have a range of public health communicable diseases that are public health threats. So COVID-19 is still a pandemic. We have seen increases in arbovirals. So we would have seen, the later half of last year, we saw increase in dengue and other types of infectious disease. We see gastro, we see outbreaks of, norovirus and other types of gastrointestinal infections in cruise ships. And we saw a resurgence of measles and other things. Right. So we are seeing this wide array of public health threats. So we have communicable disease, non-communicable disease, we have environmental threats, we have climate change, we have disasters. We've seen the impact of Hurricane Beryl, and we've seen with climate change, increase in food and waterborne disease. So when you're dealing with all these small islands with many different threats, you really have to have a kind of multifaceted regional approach.
And it's an approach I know that it's very close to your heart as well, seeing that you're able to use so much technology and innovation into making your vision a reality. So tell me a little bit more about how technology plays a role increasingly in the public health sector and in aligning with your vision.
Yes, well, as you say, this is near and dear to my heart. We can't keep doing the same thing and expect a different result.
Right.
We have to have new systems, robust systems that are early warning. What do I mean by that? Something is happening, you need to know instantly, because we are so tourism dependent, and that system must have an alert mechanism that allows you to alert the relevant persons to say something is happening. Let us nip that spread in the bud before it spread to large numbers and cause disease outbreaks. So we have been implementing new innovations. Some of them regional early warning systems. The other is, we recently used this for the Cricket World Cup, is a real-time mass gathering surveillance system. This is a real-time surveillance system that allows for early warning and response instantly and for nipping the bud. And we use this in Cricket World Cup where we were able to...
Yes, in the ICC Men's T20 World Cup, yes.
And we were able to nip something in the bud, and you didn't see anything out there, right? Because we were working. We have the district health information systems. We have networks, vector-borne networks and others that are all innovative laboratory networks, all designing for real-time, timely response and intervention to meet needs.
So you definitely have a lot of work cut out for you, not just in the 26 member states, but specifically for Trinidad and Tobago. You're a South girl like myself. So as a Trinidadian, and given your background that has influenced your vision for CARPHA, tell me, what is your personal commitment to improving the public health sector, and not just in the region, but significantly here in Trinidad and Tobago?
Yes, well, I'm a Trini, yes, and of course, from where I sit, I want to see and I want to work very closely with the ministry and all the different stakeholders for really having improved public health in Trinidad and Tobago. But from where I sit as the executive director, for me, is how we do this regionally. And if we do this regionally, we will also improve in Trinidad and Tobago. And Trinidad and Tobago is unique. Growing up in South, we face the same wide array of public health threats, and you have, these different, regional health institutions, and you have to deal with all these different networks and stakeholders. So that allowed me to realize, look, it's not one size fits all.
Correct.
It gave me that ability to know that you have to work, not just at the highest level, but you have to work with the national epidemiologists, the persons on the ground, to get implementation, and a wide range of stakeholders, not just the public health persons, the environmental persons, the vector-borne persons, the persons in the veterinary area, persons in the tourism sector. So.
All right. Well, with that said, I mean, you answered that just perfectly. You're committed to not just working across the region, but also right here at home through all sectors, having a holistic approach in your vision and mission for CARPHA. So with that said, we want to thank Dr. Lisa Indar, the new Executive Director of CARPHA. Thank you so much for being with us this evening. All right.
Thank you very much.
Stay where